Coming up today, stimulating the brain to stop seizures before they start. Meet someone who is finally finding relief after living her whole life with epilepsy. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. The woman we're meeting today grew up trying to manage her seizures. Living with epilepsy meant she couldn't drive a car. She never could hold down a job, but she hasn't given up the years-long effort to find some relief. But first, before we get to that, we're going to get to our morning rounds. The FDA has approved the first ever blood test that can help diagnose Alzheimer's disease. It can detect biomarkers that otherwise would require a spinal tap or PET scan to find. Helping us explain how it works and who it's for is Dr. Jeff Burns, a neurologist specialized in treating and researching Alzheimer's disease. He is co-director of the University of Kansas Alzheimer's Disease Research Center. Dr. Burns, always great to have you. Good morning.
Good morning. Thanks for having me.
Well, you spoke about this blood test on a recent episode of Choices, Hope, and Science, and we are putting a link and a QR code on the screen for people to find that series. But what does this test look for in the blood?
Yeah, so this test, it's an important advance because it gives us tools that we have way more access to. Like you said, we don't need spinal taps as much, and we don't need amyloid PET scans to detect amyloid in the brain. And that's what this test does, is it gives us sort of a window to detect the likelihood that somebody has amyloid build up in the brain. And amyloid is something that we see build up in patients with Alzheimer's disease.
How does the blood test change the current process for diagnosing Alzheimer's?
Well, we see it, it's just playing out right now where we're really introducing this test into our own memory clinic. We've been doing it for the last couple months, but we're also introducing it into primary care and neurology and really trying to get clinicians to use it to help understand what's driving cognitive changes. And also, we think it's going to help us avoid tests like the, costly amyloid PET scans and then invasive spinal taps. But it's going to be introduced really as a routine test that we use to evaluate our patients who have memory problems.
So then who should be getting this test? And is this something patients should then be asking their doctors for?
Yeah, so that's a key question, and who is it for? And it's really for patients who have clear memory changes. So really only patients who have clear memory changes, even if they're mild. If they have clear and persistent memory changes, then it's worthwhile to be looking for, to detect this amyloid in the brain to help understand what might be driving those changes. It's important because it's really not for people who are concerned about their long-term risk, not yet at least. We hope to understand the role of this test in long-term risk assessments and in identifying people who are at high risk and then doing things to prevent dementia. That's where everything's headed. That's what we're excited about. But the key right now is this test is for people who have memory changes and really not yet to assess risk for people who don't have memory changes.
Dr. Burns, big picture, if someone wants to protect their brain health, what should they be doing?
Yeah, so I mean, the key right now is that, the best information we have is exercise and diet and sleep and, lifestyle. And so really focused on exercise, increase, the steps in your day, build in a little bit of higher intensity exercise where you're really focused on pushing your heart and lung function, try to build muscle mass, a little bit of resistance exercise, introduce that into your life if you're not doing it. I need to do that. And eat well. And a Mediterranean diet pattern is what we recommend right now. The best information that we have from our research is that a Mediterranean diet pattern is the best, long-term for your brain. But we have a long way to go to really understand the role of lifestyle. But we do believe that the choices you make in your lifestyle do have some effect and some impact on your long-term risk of dementia and Alzheimer's disease. So if you're not exercising, if you're not eating right, make those changes, and we think they really do help long-term in terms of your dementia risk.
Yeah, don't be too hard on yourself, Dr. Burns. We could all probably make some good changes, right?
Yeah, we could.
Yeah, for sure. Dr. Burns, always great to see you and hear your insight. Thank you so much.
Okay, thanks.
We are so glad to be joined by Amy Smith this morning, who is sharing her story with us. Great to have you.
Thank you. It's nice to be here.
Great to have you. We are also joined by Dr. Carol Ulloa, an epileptologist and the director of the Comprehensive Epilepsy Center here at the University of Kansas Health System. How are you?
Good morning.
Always great to have you, and functional neurosurgeon Dr. Jennifer Chang. Great to have you back with us.
Thank you.
Amy, you had a deep brain stimulator placed in about 3 years ago, and we're going to explain what that does and how it helps here in just a few minutes. But your story with epilepsy goes way, way back from when you were a baby.
Yes.
What did your parents tell you about some of those first seizures that you had?
My mom said my first one, I was 9 months old, and it really scared them. Even her being a nurse, you know, I guess it's different when it's your kid versus a patient. And
I bet.
So, and she said they took me to the doctors and got some medicine, and she said after about 2 or 3 seizures, that's when they started monitoring me for epilepsy. And so,
yeah, it must have been a very scary time as a young parent watching that happen with your young child. What were some of your earliest memories related to epilepsy?
It was more after I hit puberty, you know, and I know I was on a lot of medications, and back then there wasn't as much known about epilepsy as there is today. And so I was kind of made fun of, and I was kind of, you know, kept in, I don't want to say on a leash, but, you know, I was very protected by my family and stuff. So I didn't get to go out and go to parties and stuff like that, but I still had a really nice home life and stuff. So.
I know your father's here with you today. You have a very wonderful family and very close with them, and that's so nice. But yeah, it was an unusual childhood because you're right, you had to be protected, and there was so much unknown, so many unknowns for you back then. What were doctors telling you and your family? Was there an official diagnosis back then for you?
The diagnosis came after I hit puberty, and because that's when I really started having the grand mal seizures. And I don't remember when exactly it was diagnosed, but all throughout my teenage years, I went through several different medications with no real benefit and stuff.
Trying different things.
Yes.
Anything that would help. Dr. Ulloa, you've told us that epilepsy has different causes and it can show up at different ages, but how often does it show up in babies?
Yes. It's not very common, but it's also not very rare. So if you look at like newborns, so babies that are born to up to 4 weeks of age, it's about 1 in 1,000 babies will have seizures. If they're preterm, that number goes up. And then another example is if you look at children between 6 months of age and 5 years of age, about 3% will have something we call febrile seizures. And Amy, you had febrile seizures initially. And so that's 3 in 100, you know, that will have those. Most of those kids will not develop epilepsy lifelong, but a fraction will, like Amy did.
But what does a seizure look like in a baby?
It can be really hard to notice. The brain is not completely formed, and those connections are not all there, and so the physical signs can be quite subtle. So it could be abnormal eye movements, the breathing changes, they might vomit, or the body moves in odd ways, but not necessarily the way someone would think a seizure would look like. So it really takes an astute doctor who has that suspicion and then does the testing to confirm it.
So, Amy, you started medications as a child, is that correct? Dr. Chang, are there surgical options for children with epilepsy?
Yes, absolutely. There are numerous different types of surgeries that can be done to treat patients when their epilepsy does not respond to medications. So anything from resections to also the neuromodulation techniques that we are currently are FDA approved for adults. Some people are also using them in children as well.
So, Amy, how well did medications work for you as a child and a teen? Just kind of hit or miss?
It was mainly miss. When I started seeing Dr. Ulloa, she got me on Keppra and Lamictal, and that's when I started having the best response to medications.
were there triggers, things that you would know would lead to a seizure? How did you know they were coming on?
I don't have any aura, so I would never know that they were coming on. I would just have them. Some of the triggers were stress, sleep deprivation, and trying to think. Well, it was. But
Lots of different things.
yes,
Yeah.
a lot of different things. You know, flashing lights.
Sure.
Back in the day, it was computer screens because they're not. They don't look like TVs back then.
I think
you know, 30 years
I think
ago.
I remember you mentioning that to me.
Yeah.
Like, did that affect you in school?
I really wasn't allowed to use computers. I
Yeah.
think in high school I was still the only student using a typewriter.
Yeah, yeah.
So
Dr. Joe, how does puberty then affect epilepsy?
It can make it worse. It can make it worse because there's this surge of hormones, and some of those hormones act on the brain in a way that makes it what we call hyperexcitable, so it makes it more likely for seizures to happen. In fact, some women have their first seizure in the time of puberty or that first year where they have their first period.
And that's what happened for you?
Yes.
Tell us about that.
I don't remember the exact thing, but I know when my period would come on, that's when I would have more of a cluster of seizures, and
When we think
It worse.
it made it worse.
It made it worse.
Yes.
And when we think seizures or when we think epilepsy, we naturally think the symptom of a seizure. Are there other symptoms that people need to be aware of, and what are they?
Yes. First of all, symptoms of seizures can be very odd, you know, and just weird things people might experience, like sudden panic or a sudden weird feeling in their stomach, but also memory lapses or feeling like their memory's worse, is gradually getting worse. Things like depression and anxiety are common symptoms, headaches. And so it's something that affects your life in several ways, not just the seizures.
Amy, when did you start seeing the doctors here at the Comprehensive Epilepsy Center?
I started off down at the Landon Center, and then I got referred to Dr. Joe, what was it, about 8 years ago?
Something like that.
Yeah. And so I've been seeing her ever since, and she got me started on a regimen that worked the best that any medication has worked.
So you've tried several things, and Dr. Chang, Amy tried VNS, a vagal nerve stimulator. Explain what the vagal nerve is and why it might be a good target for treatment.
So the vagal nerve is a nerve that runs in the neck that controls a lot of the autonomic body functions, such as heart rate and breathing. So we think that autonomic stimulation, by stimulating the vagus nerve, can signal to the brain to decrease seizures.
So Amy, did you notice any change in the seizures?
Not with the VNS, but it did help stabilize my mood, so I was able to go off my antidepressants.
So is that sometimes a typical reaction to that?
Yes, actually, some people, it's also a treatment that can be used for treatment-resistant depression as well.
So why was a deep brain stimulator then a better option for Amy?
Well, we knew she was drug resistant, so taking a lot of medicine, still having seizures. She tried the VNS, and it really was not a significant improvement in her seizures. And we know she has generalized epilepsy, which means there's not a focus that can be removed to treat her epilepsy. And so thereby stimulating the thalamus with deep brain stimulation is a great option.
So Dr. Chang, explain then how the DBS works.
So for the deep brain stimulator system, there are 2 wires that are implanted into the brain, into a target within the thalamus. So there's one for the right brain and one for the left brain. And then those wires are connected to extension wires brought under the skin and connected to a battery, which is implanted under the skin of the chest. So as you can see in the little schematic, that electrical stimulation travels to the brain target in the thalamus to treat epilepsy.
And you shared a brain scan with a couple of lines and spots. What are we seeing here?
So this is an example of deep brain stimulation for epilepsy, targeting the spots are the anterior nucleus of the thalamus, and the yellow lines represent the wires that are implanted. So the anterior nucleus of the thalamus stimulation is an FDA-approved treatment for focal epilepsy. So actually, Amy's is a little bit different because she has generalized epilepsy, and we treat with a different target also within the thalamus called the centromedian nucleus for generalized epilepsy.
So Amy, brain surgery, the sound of that can sound scary. What were you thinking when this was presented to you, and how were you feeling before surgery?
I was actually excited for it, and you know, a lot of people would get nervous and stuff like that, but I was just more like, oh, let's get this done, you know. And
You were excited for this option.
yes, yes.
So it takes time to recover. How soon did you notice the change after the Deep Brain Stimulator was implanted? Was it right away, or did it take time?
It was hard to say, because I mean, I was having about 3 to 5 seizures a year, and so I was kind of hesitant and stuff when I first got it, but then I kept seeing more and more progress, more and more time without a seizure and stuff, and ended up going about 1.5 years without a seizure, which I was ecstatic about, and my family was too.
I bet they were thrilled
Yes.
to watch a change in you.
Yeah.
Dr. Jowett, does the DBS need to be calibrated over time?
Yes, absolutely. So when you first have it placed, then you come into the office and we turn it on, but it's electrical stimulation, so you have to do it gradually. You can't do it full force from the beginning. So you turn it on at a low current and then step by step go up, watching how the seizures are doing until you get to kind of the ideal parameters.
And you shared an image showing the DBS in action. So what are we seeing here?
Oh, so this is something that the DBS has an ability to record local field potentials. And so it can be useful sometimes in tracking a person's seizures. So for example, so where you see those like pink lines, that's where the person pressed the button and said they had a seizure, and you can see that there's a peak in the local field potential showing that a seizure was recorded. One time, Amy, it was very useful for you because you had kind of a weird episode and we weren't sure, was it a seizure, was it not? And it didn't show as a seizure here, and I think that helped us kind of figure things out. It was actually a side effect to a medication.
And Amy, you have a show and tell for us on your phone?
Oh, yes.
How does that work?
The DBS is with the Medtronic system, and well,
Take your
wants
time.
to come out.
Sure.
Get stuck. There we go. And this is to activate it, turn it on, and stuff. And then with my phone, there we go. Well, this morning it wants to take its time. And so, but with this,
So what are you able to do on the phone?
I'm able to, like if I'm getting MRI of my brain or something, I'm able to turn the device off with the phone and other things like that. And
You can actually turn it up. Like we can allow the ability for the person to turn it up or down on their own, or off, as she said.
Yeah.
That's fantastic.
Yeah. So, but it's been interesting, and then like this.
Yeah, let's see that.
It says that the DBS is open for me to open it, and it gives me different options of what I can do.
And that must make you feel really in control of
Yes. It gives me a lot more control feeling than I've been used to in the past.
Yeah.
So.
And how new was that? How often, I mean, this type of technology for somebody to be able to do this on their phone?
Yes, it's you know, when a new device comes out, there's also progress within that, you know, that science. And so over the years, there's new types that have come out. And like now there's a rechargeable one that has the latest technology, plus it's a rechargeable battery. So the person doesn't need to change the battery for like 15 years. So even within this new device, there's also advances that happen over the years.
Very cool. Yeah. Thanks for showing us that. Well, we love answering your questions during our program, so please use this opportunity to ask those questions now. You can drop those in the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Amy, you mentioned 1.5 years had gone by since you had a seizure, but how many seizures do you have? Give us an idea.
The last seizures that were recorded was back on November 11th of last year. And I had a little trio of them that day, and my father was with me, so.
But nothing since.
Nothing since. So, and we turned the device on in February of 23 to November of last year. And so everybody was really excited that it went that long. Nobody was happy to see me have a seizure, but we were like going from 4 to 5 a year down to, 1 in a year and a half.
That's a big deal.
Yes.
Dr. Joe, is it possible to promise a patient that they'll be seizure-free?
No, the devices, the implantable devices are not a cure for epilepsy. They're meant to lower the number of seizures a person has. And so I'm always very clear with patients about that. I think you have to set the right expectations. But there is a fraction of people that stop having seizures for long periods of time. And so when that happens, we celebrate, we're really excited. It's awesome to see, but it's the exception and not the rule.
Dr. Chang, how exciting is it to see someone like Amy post implantation just doing things that they've never done before?
It's so rewarding. Honestly, that's why this is the best type of function. I think functional neurosurgery, which is the treatment of people who have epilepsy, is just a very rewarding subspecialty because it's fun to see that people can, kind of regain, aspects of their life that they couldn't.
You truly get to see this before and after moment with your patients.
Right.
Yes, very rewarding. Amy, again, I mentioned I got to meet your lovely father before I stepped into the studio this morning. What kind of support have you relied on over the years from your family? What kind of needs have you needed from them?
My biggest thing has been transportation, and my dad is really great about getting me places where I need to go and taking me out shopping and stuff.
He's like your personal shopper.
Yeah.
I love that.
Yeah, except he doesn't like the shopping.
Oh, I think he kind of does.
Yeah. And my mom's good about getting me to appointments and stuff too, and taking me to family events, and so.
But it's been quite bonding for you, right?
Yes,
I mean,
very much.
You guys have embraced it over the years.
Yes.
You have. How is life now? What are you noticing the biggest changes for you?
Well, I'm getting more, feeling more independent. When I was having the seizures, it'd be like every 3 months. Once it got to 3 months, I'd be like, oh God, when's it going to happen? But now that I've gone such a long period, I get out more and I'm not constantly worrying when the next seizure is going to be and stuff. So I'm feeling a little more freedom and stuff. So that's really been nice.
So it's like a congratulations is in order. It's so fantastic. As Dr. Joe said, it's like you celebrate these wins.
Mm-hmm. Yeah.
Let's get to some questions from our viewers this morning. Lisa wants to know, is DBS only for generalized epilepsy or focal as well?
So Deep Brain Stimulation is FDA approved to treat focal epilepsy, actually. So it does not yet have FDA approval to treat generalized epilepsy. So in this case, treating you, we were doing it off-label, using a known approved medical device to treat someone who has generalized epilepsy. So there's a lot of research being done currently in this field, and based on that known research is how we recommended this surgery to Amy. Because we knew that there were good results being published. Even though the FDA approval wasn't there yet, it seemed like the best option for her. This is why we offered it.
Alexis has a comment thanking Amy for sharing her journey. It's going to help so many other people better understand epilepsy who might not know someone who hasn't. So thank you for sharing that. She also wants to know what happens if Amy has a seizure and she's not around family or friends that knows that she has epilepsy. So maybe in the past, what has that been like for you?
Well, since I live on my own, I have to go by my instincts and knowledge of what my body feels like after I have a seizure to be able to help realize that I had one. I'm disoriented. I always get a migraine above my left eye, and I'm just very unbalanced and stuff. So I just try and work with that and just go lay back down or something, and then I'll let Dr. Ujoa know, and I'll let my mom know.
Communicate.
Yes.
Lots of communication.
Yes.
Jeremy says, After the implant, have you noticed any changes or benefits beyond having less seizures, like positively affecting your mood or memory or anything like that?
Well, like I said, with the vagal nerve stimulator, that really helped get me off my antidepressants. So I do have a very positive outlook on stuff, and I'm always trying to smile and be happy. And, you know, I don't have that constant nagging fear in the back of my head. So.
Well, your doctor said
Yeah.
this morning, what, you light up a room?
She does, yes.
She does.
Always makes me laugh.
Question also, do seizures cause brain damage? Can they cause brain damage?
They can, but I think, you know, it's all about the details. So the classic way in which they can cause damage is if you have a very, very, very long seizure. So like 30-minute long seizure or many seizures within 30 minutes. And that's a medical emergency. But the other way that I see in patients that have that drug-resistant epilepsy is just years of having seizures, of continuing to have seizures, often leads to like memory loss and just cognitive decline. And so that's one of the reasons we say it's so important to get the seizures under control so you can sort of halt that decline.
Last question, Amy, for you from Alexis. What's the one thing, if you could say there's one thing that you couldn't do before that you can do now, like maybe even freedom-wise? Like, what's the one thing that that you could say has changed, that stands out the biggest?
That's hard. Just like I said, the freedom to be able to go out in public more and not have that constant nagging suspicion in the back of my head. That just makes me feel empowered and stuff. Obviously, I still can't drive, so I don't have that luxury, but
empowerment is huge.
Yes.
That's big. That's big. Dr. Joa, what's the big takeaway from this story?
I think in this case where we're focusing on Amy, it's don't give up. If you've had a surgical evaluation years ago, 15 years ago, I had all this testing, they told me I wasn't a surgical candidate, come back. Because the science, changes things, there's new things developed. And so 15 years ago, Amy, this was not an option for Amy. So go back to a comprehensive epilepsy center. Like here at KU, we're the only level 4 comprehensive epilepsy center in the state of Kansas. But see a specialist that can do this evaluation and then tell you the up-to-date treatment options for you. Because nowadays, basically everybody is a candidate.
Dr. Cheng, what's the big takeaway today?
I would echo what Dr. Joe was saying. It's a very exciting time, honestly, in this field with epilepsy surgery advancing as we speak. And I think that that's been very exciting. So, 5 years ago, things were different. 10 years ago, things were different. So new things keep being applied. So, just like you said, we only just started doing deep brain stimulation for generalized epilepsy not that long ago, and it's still not FDA approved, and so that still needs to happen. And so it's going to take the evidence of, lots of patients getting treated to gain the FDA approval.
Amy, you're educating people today, and thank you for sharing your story.
Yes.
What is the big takeaway for those who are watching and listening this morning?
I mean, I have to agree with both of them. It really starts with finding good doctors that can talk to you on your level and be able to explain things and give you the options. And Dr. Joe has been awesome with that. And Dr. Cheng, I really appreciate her services and her time with me too.
Well, thank you so much for being here with us. Be well.
Thank you.
All right. Thank you to all of our guests today. Thanks to our viewers for being here with us. We'll see you back here tomorrow. Long drives with fewer specialists. In rural America, cancer care comes with extra stress. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Ideas for bridging the gap. One cancer survivor's mission to make his experience a thing of the past. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.